Hello, everyone. Just getting ready to set up, getting the setup ready to do another live. Okay, we're on. Hi, everyone. My name is Kevin, and I am representing Center of Balance here. And we are a group of acupuncturists and herbalists based in Dinsdale, Hamilton, as well as Auckland, Remuera area. And so we'll be keen to help you out with any problems that you might have with your health, or if you know anybody who's suffering from health problems, we'll also be happy to help out. So I'm doing another live video today, continuing the topic I was talking about last time, which is lower back pain. So last time we covered the what is lower back pain, and today we'll be talking about what are the causes of lower back pain. So I'm sure many of you who are watching have the experience or know somebody who suffers from lower back pain, because that is a very common phenomenon around the world. So I think I mentioned last time in the United States, it's 80% of the population has suffered lower back pain being, at a certain stage in their life. So 8 out of 10 people. I'm not sure about New Zealand, but I'm suspecting it's relatively high. Even myself have suffered from lower back pain in the past. So let's go into the topic, and I hope what we're covering today will be able to give you a good insight and also be helpful in helping you alleviate your lower back pain if you are suffering from lower back pain. So let's have a look at the Western medicine's perspective on lower back pain. What are the causes of lower back pain? Number one, strength. So the muscles and ligaments in the back can stretch or tear due to excessive activity. Symptoms including pain and stiffness in the lower back, as well as muscle spasm. Rest and physical therapy are remedies for these symptoms. The next one is disc injury. The discs in the back are prone to injury. The risk increases with age. The outside of the disc can tear or herniate. A herniated disc, which is also known as a slipped or ruptured disc, occurs when the cartilage surrounding the disc pushes against the spinal cord of nerve roots. The cushion that sits between the spinal vertebrae extends outside its normal position. This can result in compression of the nerve root as it exits from the spinal cord and through the vertebral bones. Disc injury usually occurs suddenly after lifting something or twisting the back. Unlike back strain, pain from a disc injury usually lasts for more than 72 hours. The next cause is sciatica. Sciatica can occur with a herniated disc if the disc presses on the sciatic nerve. The sciatic nerve connects the spine to the leg. As a result, sciatica can cause pain in the leg and feet. This pain usually feels like burning or pins and needles. The next cause is spinal stenosis. Spinal stenosis is when the spinal column narrows, putting pressure on the spinal cord and spinal nerves. Spinal stenosis is most commonly due to degeneration of the discs between the vertebrae. The result is compression of the nerve root or spinal cord by bony spurs or soft tissues, such as discs. Pressure on the spinal nerves can cause symptoms such as numbness, cramping, weakness. You might feel these symptoms anywhere in the body. Many people with spinal stenosis notice their symptoms worsen when standing or walking. The next cause is abnormal spine curvatures. Scoliosis, kyphosis, and lordosis are all conditions that cause abnormal curvatures in the spine. These are congenital conditions that are usually first diagnosed during childhood or adolescence. The abnormal curvature causes pain and poor posture because it places pressures on muscles, tendons, ligaments, and vertebrae. Other conditions. There are a number of other conditions that cause lower back pain. These conditions include arthritis, it's an inflammation of the joints, fibromyalgia is long-term pain and tenderness in the joints, muscle, and tendon. Spondylitis is inflammation of the joint between the spinal bones. Spondylosis is a degenerative disorder that may cause loss of natural or normal spinal structure and function. Although aging is the primary cause of the condition, the location and rate of degeneration is specific to the individual. Additional health conditions that can cause lower back pain include kidney and bladder problems, and pregnancy, endometriosis, ovarian cysts, uterine fibroids, cancer. Okay, so the above, what I've just talked about was the Western medicine's perspective on the causes of lower back pain. How about traditional Chinese medicine? So I just want to do a recap on what the traditional Chinese medicine says about what causes lower back pain. There are actually, let me have a look. There are actually 5 main causes of lower back pain. So the first one is what we call a taiyang, wind, cold invading the lower back and causing pain. So what is taiyang? Taiyang meridian. So taiyang meridian is actually your bladder meridian that runs along from the leg, from the side of the leg, up the back of the legs, all the way up the lower back, upper back, and to the head. So that's the taiyang meridian. So Chinese medicine believes that the wind and cold can invade the body. And the first defense that they go through is the taiyang channel, which is the bladder channel. Okay. So when the bladder channel is invaded, because the bladder channel covers such a long, large area, so oftentimes you will have lower back pain accompanied by, for example, headache or cold symptoms. So that's when the cold or wind invades the bladder meridian. The next one is dampness, wind, and cold invading the body. So this type of lower back pain is caused by dampness invading the body, and mostly due to eating too much vegetables or fruits, cold vegetables and fruits. Or you had an injury, but never you never fully recover from it or got treated properly, and that can cause dampness, okay, to congeal inside your body. And oftentimes you notice in cold or wet weather, then you're starting to, if you had injury to the lower back that didn't heal properly, in the cold and damp weather, sometimes you feel it comes on, it aggravates, it's exacerbated by the cold and damp weather, okay? The next cause is excessive laboring or overuse, causing lower back. So we say that if you do too much exercise, moderate exercise is good for you. But if you overdo it, then you wear yourself out. And when you wear yourself out, if you're doing a lot of, for example, desk work, or you just work too much and you become too tired and run down, or you indulge in too much sexual activity, then you tend to wear your body down. Okay, so when that happens, you have, if you wear yourself out, then you're very easy to get a lower back pain, and that is a form of degeneration. You're advancing your degeneration. So maybe when people who usually get lower back pain when in their 80s, and if you don't be careful and you overexerted yourself and work too much and exhausted your energy, then maybe you get your lower back pain in your 60s. So that is a form of advancing your degeneration. Okay. The other cause is trauma. You had a trauma, and that causes damage to your lower back, and the trauma causes the blood and chi. Blood and chi. Chi is the energy to not being able to go through, and therefore causes blockage and pain. It comes. So oftentimes you can see people who's had an maybe car accident or sports injury, or exerting themselves in the wrong way when they're lifting heavy objects or doing chores, so that's very often seen. The last cause of lower back pain is period pain. So women often get period pain, lower back pain during the period. This is because when the period comes, their blood and chi is not circulating properly, and causing pain. So these are the 5 common causes of lower back pain. So now I want to talk about how do you prevent lower back pain. So because prevention is probably the best that you can do to avoid lower back pain. Once you get lower back pain, it's a bit too late. Then you have to look for doctors and go into alternative health therapies. So probably your best option is to prevent it from happening. So how do you prevent it? The first point is that your life has to you have to have a good rhythm of your your lifestyle. You need to sleep early and get up early. Don't try to put off getting up. Okay, don't try to just snooze and So when it's time to get up, you should get up. Don't sleep till 8 or 9 o'clock. And that's not going to help you, because the more you sleep in your bed, your body is not moving, your blood and your energy is not circulating, and that gives you a higher chance of developing lower back pain. The next point is you need to eat a good regular diet. So don't eat a lot of cold vegetable and fruit. So a lot of people will think, getting cold smoothie, one smoothie in the morning with vegetables and fruits is really good for you. In a sense, yes, you can say that it's good for you because you're getting the freshest fruit and vegetable you can get, and that's good for your body. But on the other hand, you also have to bear in mind that these things are not cooked, and your body has to spend a lot of energy in digesting them. Cooked stuff are more easy to digest, and raw stuff are harder on your body. You have to have a very strong digestive system to be able to what do you call it, to process it. And what's even worse is a lot of people, they just tend to grab the cold food or vegetable straight out from the fridge. Imagine when you're making a smoothie, you get those frozen berries and chuck it in the blender and you blend it out and drink it. And that is really hard on your body too, because imagine if you drink cold water or cold smoothie, when it comes out, the pee is warm, right? So where did all the coldness go? Your body has to spend extra energy, heat the coldness up and process that out from your body. So it's actually not good for you either. The next one is to be aware of the changing weather, especially during the day and night, okay? In New Zealand, there's a saying that 4 seasons in one day. There's a song actually about that. So you have to be aware that the weather changes, particularly in the early morning and closer to nighttime, okay, at dawn, okay. So these are the time when the temperature is starting to drop, and a lot of people are unaware that the weather is getting cooler, and that time the coldness can actually get into your body, okay. The fourth point is not to carry over heavy loads, okay. If you're carrying heavy stuff, you have to have the correct posture. The worst one is to carry things and then lean on your side. And that is the worst one. That can hurt your back the most. So you got to be careful when you are carrying heavy things. The fifth point, do not drink excessive alcohol or indulge in excessive sexual activity. And because in Chinese medicine, we say sexual activity is very taxing on the kidneys, because the essence comes from the kidney, and the essence can produce life. So each time when you engage in such activity, you are exhausting a little bit of that essence. And that essence is actually what we call treasure in Chinese medicine. It can nourish your brain, can nourish your spine, can nourish your bones. You can, if you have strong kidney, your bone growth is very strong. So if you're not careful and you do it too much, that can actually exhaust your essence and causing kidney deficiency. And kidney is right here, right? So it's actually in the lower back area. And sometimes you get lower back pain. You wonder, oh, how did I get that? So you got to think about it, what you're doing, okay? It is good to, the next point is, it's good to do some training to strengthen the back, the lower back. Swimming is really good. Riding a bike or doing yoga, these are all very good activities, yeah? So 2 to 3 times a week, you can mix it up. Do some Tai Chi, do some swimming, do some riding the bike, and do some yoga. Yeah, fantastic. And do some gentle exercise once you get out from the bed. That's going to help you speed up the circulation. So some people, I think a lot of people, they tend to wake up and just go straight to work. And what they don't realize is you get up, your body is, when you get up, your metabolism of the body is quite slow. And you're not moving when you go to work. Most of the time, if you're an office worker, you're just sitting there all the time. So your body hasn't really moved for a number of hours after you got up. And that's going to cause problem, especially if you're sitting. You're not standing, you're sitting most of the time. your body is in like this shape, and that doesn't actually promote energy or blood circulation either. It sort of stops. See, stop. So if you're doing that, if you're sitting down for a long time at desk in a desk job, and you have to be very careful. It's good to do some stretches, some light exercise when you get up before you go to work, and then do some more exercise once you finish, because you've been spending a lot of time at your desk, sitting down, not moving. Okay, if you can manage that. The next point, next I want to give you some tips in what you can do to manage your lower back pain. There are some very effective points for treating lower back pain if you are already suffering from lower back pain. So as I mentioned before, you can see that there, as I mentioned before, the bladder meridian runs from the feet all the way up the back, the buttock, the lower back, upper back, all the way to the head area. Okay? Now, the points I want to give you is actually along the bladder meridian. So imagine that. So that's why it can actually help you, because it's for a reason. So these points here at the back of the knee, in between the two tendons, you have two tendons here. In the middle of these two tendons at the back of the knee, it's called Weizhong. This is the Weizhong meridian point. And you can do it now and just try have a rub on that point. If you have lower back pain, you should be able to find some problem there. Okay, I tried it myself, and I could feel my left Weizhong is actually more painful than my right. So that means something is not quite right there. So once you find that gritty bit or painful bit, try to rub it each day 100 to 200 times. And that can help you alleviate your lower back pain. Okay, so Weizhong, remember that point. Yeah. That's what I'm going to give you today. I don't want to inundate you with too much information. So if you have any questions, you can type in the comments below, and I'll try to answer them. Yeah, so thank you for watching. And my name is Kevin. I'm from Central Balance. We are based in Dinsdale, Hamilton, and we also have a center in Auckland, Maeroa area. So if you need any help, thank you. If you need any help with your lower back pain, or if you know anybody who's suffering from lower back pain, we'll be more than happy to have a talk to you and help you out. Thank you for watching. Tamara, see you next time. Bye.